A very good morning to all of you. At the outset, I would like to thank the organizers of EMCON 2021 for giving me this opportunity to participate in this esteemed emergency medicine conference. I am Dr. RADHIKA RANI CHANDRA, working as Associate Professor and in charge head of the Department of Emergency Medicine at ACSR Government Medical College, Nellore, Andhra Pradesh. I did my undergraduation from Guntur Government Medical College, Guntur, and post-graduation in MD Accident and Emergency Medicine from Vinayaka Missions under the leadership and mentorship of Dr. V.P. Chandrasekharan Garu, and did my MD Anesthesia from KIMS NTR University of Health Sciences, Andhra Pradesh, under the mentorship of Dr. A.S. Kameshwara Garu. I am fortunate to be one of the instrumental person in establishing emergency medicine departments in all government medical colleges across the state of Andhra Pradesh. Now, I would like to share my presentation on a special notes on sexual assaults. This is the overall view of sexual assaults, like introduction and definition, types of sexual abuse or violence, epidemiology across the world, challenges in emergency room, medical legal examination, and preventive measures. Coming to the introduction, rape is one of India's most common injurious and heinous crimes against women, and every 15 minutes, a woman reports rape in India. The effects are devastating. Health professionals play a dual role in responding to the survivors of sexual assault. First, to provide the required medical treatment and psychological support. Second, to assist survivors in their medical legal proceedings by collecting evidence and ensuring a good quality documentation. For accurate examination and evidence collection, it is important that every doctor understands what constitutes the offense of rape, especially ER physicians, because they are the first responders who receive these patients at the doorstep of the emergency department, at the doorstep of the hospital. Coming to the definition, WHO defines sexual violence as any sexual act, attempt to obtain a sexual act, unwanted sexual comments or advances, and acts to traffic or otherwise directed against a person's sexuality using coercion, threats of harm, or physical force by any person regardless of relation to the victim in any setting, including but not limited to home or work. So sexual assault, a form of sexual violence, is a term often used synonymously with rape. So usually these two are like, rape is commonly used, common term for sexual assault or sexual violence. So sexual assault could include anything from touching another person's body in a sexual way without the person's consent, to forced sexual intercourse, child molestation, fondling, and attempted rape. So again, it can be acquaintance rape, someone victims already knows, or stranger rape, someone victim doesn't know. These are the forms of sexual violence you commonly come across. So different forms of sexual violence include peer violence, suicidal behavior, child maltreatment, intimate partner violence, teen dating violence, sexual violence, elder abuse, right from childhood, adulthood to adolescence. These are the common different forms of violence that we come across. Human trafficking is a form of modern day slavery, and it involves the use of force, fraud, or coercion to exploit human beings for some type of labor or commercial sex purpose. And victims are often lured with false promises of well-paying jobs or manipulated by people they trust, but instead are forced or coerced into prostitution. So each year, around 17,500 individuals are brought into United States and held against their will as victims of human trafficking, which is already documented. These are the common types of victims that we come across: women, children, sex workers, persons disabled, transgender, and religious discrimination. Coming to the epidemiology of sexual violence, WHO states that 1 in 3 women, around 736 million population, and 1 in 4 young women between the age of 15 to 24 are subjected to physical or sexual violence. And this is unchanged. This epidemiology is unchanged over the past decade. Coming to the CDC, women, men, 1 in 5 women and 1 in 38 men experienced completed or attempted rape during their lifetime. 1 in 3 women and 1 in 4 men experienced the first time between the age of 11 to 17 years of age, and 1 in 8 women and 1 in 4 men reported before the age of 10. There is a documented evidence that on April 14th in Plainsfield, New Jersey, elderly woman aged 86 has been sexually assaulted at her home. And on May 19, 2012, Robert Mickelson, youngest victim of sexual assault, was announced, and he was 19 days old. So that is a wide variant of victims that are being victimized for sexual violence. What are the common challenges in emergency room? Coming to the emergency room, you have to do a quick triaging of victim, resuscitation, stabilization of the patient, informed consent should be taken, which is mandatory, history of the violence, how it happened, where it happened, and general examination of the patient, mandatory sample collection and preservation, medico-legal issues and psycho-social issues. All this has to be taken care of. And these are the challenges that you face in emergency room of how you take care of these patients. General examination. Police personnel should not be present at the time of history-taking, examination, and evidence collection. The victim should be requested to undress herself. The whole body must be examined for marks of violence, and following are the common injuries that you need to examine from head to toe. Examination of the genitals, especially history of last menstrual period, must be asked for to differentiate menstruation from bleeding due to the injuries. So examination of the vagina and collection of vaginal secretions by instilling 15 ml of normal saline in the posterior fornix of the vagina should be done. And local signs of violence should be examined for, and the character and extent of the injury varies in proportion. And this all has to be examined, and you have to know the disproportion of male and female organs, whether the victim is a virgin or not, and extent of penetration and amount of force. All these things has to be documented and examined for. The examiner should strive to ascertain the following things: whether these marks are of injuries or self-inflicted, apparent development of victim's body when the victim is like a child, adolescent, or has come into adulthood, amount of resistance offered, corroboration of the statement of the victim. You have to corroborate all this with the statement of the victim that the victim himself or herself gives. If the consent is available, the victim's blood should be collected for grouping. This will help in ascertaining whether blood stains are of victim or assailant. A second examination after 48 hours will help. Deep bruises may reveal deep bruises which may not be evident at the first examination. As we have already spoken, that the variant of groups that are victimized because of these sexual assaults, like children, transgender, sex workers, racial discrimination. So let us go individually in according to one personnel. Coming to the children under age of 12, consent should be sought out from the parents or guardians, and usually most of the children are accompanied by abusers. So in that circumstances, see that the children are examined by screening them, and in the absence of the abusers, and always never get suspected that, or never assume that children can't give a proper history. They are very well aware and they can give proper history. Please believe what they say. A female person appointed by the head of the institute may be called for during the examination of the kid. And history can be facilitated by use of dolls and body parts. Dose of the treatment can be adjusted according to the body weight of the child. And for psychological support, it is imperative to speak with the carers of the survivor in addition to the survivor themselves. So you speak to the kid and also the survivors, whoever are victimized. Health professionals must make a note of following aspects while screening for sexual abuse. Assurance of confidentiality and provision of privacy are keys to enabling children to speak about the abuse. So you have to give them a confidence that it will be between you and the kid. Then they will speak. Disabled persons. Be aware of the nature and extent of disability that the person has and make necessary accommodations in the space where the examination is carried out. Do not make assumptions about the survivor's disability and ask about it before providing any assistance. Do not assume that the person who is disabled cannot give you a proper history of sexual violence. They are very well aware and they can very well give you the information. History must be sought independently, directly from the survivor himself or herself. And let the person decide who will be present while they are giving the history, who will be present in the room. Let the disabled person decide who are going to be along with them when they are giving history to you. Make arrangements for interpreters or special educators in case the person has a speech or hearing or cognitive disability, and maintain a resource list with names, addresses, and other contact details of interpreters, translators, and special educators in and around your hospital who could be contacted for assistance. Even while using the services of an interpreter, communicate with the person directly as much as possible and be present while the interpreter or a special educator is with the person. You always be present while documenting all this. Transgender and intersex persons. Gender identity is not constituted by anatomy, especially appearance of genitals. So don't take into consideration by seeing the genitals that this person is male, this person is female. Okay, transgender and intersex person may be unwilling to report the case to law enforcement for fear of being exposed to inappropriate questions and abuse. Therefore, adequate care should be provided for those who do not approach health institutes. So, information on the transgender status of the survivor must be treated as confidential as possible and not to be revealed without the survivor's consent. So consent is mandatory in all the victimized patients of sexual violence. The inadvertent discovery during examination or history taking that certain a person is a transgender or intersex must not be treated with ridicule, hostility, surprise, shock, or dismay. Just treat them as any normal person that comes to the emergency department or like any other human being. Please don't ridicule them. Such reactions convey that the person is being judged and is likely to make them uncomfortable and will not cooperate and will not give you proper history and information, and will not let you examine also at the same time. Sex workers had a right to receive treatment, and not providing it for any reason is punishable by law. Do not make assumptions about the person's health. Myths such as sex workers are all addicts, HIV positives are only myths. Sex workers can be of any gender. No statements blaming the survivor or his or her profession for the violence faced should be made. Only information of the current episode of violence must be documented. Please don't speak about his past sexual encounters and incidents of sexual violence that has happened in the past. We are no way concerned with the past history. We are only concerned with the present episode and present history and present violence that has happened to the person. Coming to the treatment, measures should be taken to prevent sexually transmitted diseases. Emergency contraception and urinary pregnancy tests should be conducted for reproductive age group people, and immediate emergency contraception should be instituted. And prophylaxis for diseases like tetanus, hepatitis B, and HIV should be given, and treatment of the wound should be taken care of. Counseling and psychological support should be given. Survivors of sexual violence should receive all services completely free of cost. This includes OPD, inpatient registration, lab and radiology investigations, urinary pregnancy tests, and medicines as well. Coming to the overall view of how we summarize the management of sexual abuse patients, victims in the emergency medicine department. A quick triaging, and if the patient is critically ill, then immediate stabilization of the patient should be taken care of. And if the patient is stable and oriented, then ask the history, get a consent. If the patient can give the consent, if less than 12 years of age, then they take the consent of the parent or the guardian or the person who has accompanied the child. And examination should be done for age estimation, physical, dental, and also radiological examination should be done. And treatment of the injuries and sexually transmitted infections test should be done. Prophylaxis should be given for all these sexually transmitted diseases like HIV, HPS, AG, and tetanus should be given. Prophylactic management should be given. Emergency contraception, urinary pregnancy test, if available, if applicable, should be done. Counseling and psychological counseling should be done. Information and referral to other services should be done immediately. Once evidence is collected, a dry pack and seal should be done for the collected sample and should be handed over to the police, and clear-cut documentation should be done. Treatment should be done, and once the patient is treated and discharged, a follow-up has to be taken care of. You should write the follow-up like when the patient should come back to your emergency room, or to the particular person who is going to treat from the emergency room, who is going to take care of the person from the emergency room, should be given clearly. Coming to prevention, set up a safe room where you sleep. Include cell phone, charger, door with extra locks. Practice drills in your home like a lockdown in school. Be ready for an intruder. Never allow strangers in your home. Make appointments with repairmen when someone is in home with you. Never set your GPS to home. Remember, all of us have the habit of setting our GPS to our home and switching on the GPS. Please don't do that. Don't include address on luggage tags. Only put your cell phone numbers. Skip the scar stickers, stick figures, and honored students. Date rape drugs. This is the most common drugs that are. Rape is the most common sexual violence that is happening. So always be aware. Never leave your drink unattended. Never accept drink in open containers. Only accept drinks from wait, staff, bartenders. Get help if you feel disproportionately intoxicated, extremely nauseous or dizzy, suddenly confused or ill. The most common date rape drugs usually are gamma hydroxybutyric acid and flunitrazepam. Usually the effect lasts between 4 to 12 hours, and you would never know because they have the similar effect like alcohol. They'll be mixed in alcohol and given. They are odorless, tasteless, and highly sedative. So these are the most common two rape drugs that are commonly used. Just be aware. Defense tactics and weapons. Be alert and ready to respond. Be aware of your surroundings always. Appear confident. Use an authoritative tone. Don't be afraid. Always fight to win. Weapons should never be used, but there are some everyday items that can stun your assailant, like keys, pens, sharp objects, perfumes like chili sprays, body sprays, hair sprays, your purse, your backpack. Just throw it as a sudden surprise as a defense tactic. Suppose if you're caught, go with your gut. Be aware of your surroundings. Don't be distracted by iPhones, iPads, packages. Don't be afraid to act crazy. Run, yell, draw attention to yourself. Get a 2-second head start. So make a run. If you are in the trunk of any car or anything, look for a weapon. Be ready to fight. Try to find the trunk release. Pull wires to break lights. Try to listen to where you are being taken. Get help immediately if you have been drugged. Your time to act is limited. Date rape drugs can take effect within 15 minutes. So if you are in doubt, please get help immediately. Do not tell only one person. Do not isolate yourself. If you believe someone has been drugged, get immediate medical attention immediately. Do not leave them alone for any reason. Bring that beverage to the medical staff and get it examined and get it analyzed. So this is a common overall view of the prevention of sexual violence. How do you stop it? Promote social norms that protect against violence. That is bystander approach, mobilizing men and boys as allies. Teach skills to prevent sexual violence, like social emotional learning, teaching healthy, safe dating and intimate relationship skills to teens, promoting healthy sexuality, empowerment-based training. Provide opportunities to empower and support girls and women, strengthening economic supports for women and family, strengthening leadership and opportunities for girls, create protective environment, like improving safety and monitoring in schools, establishing and consistently applying workplace policies, addressing community level risk through environmental approaches, and support victims and survivors to lessen the harms. Victim-centered services should be established. Treatment for victims of sexual violence should be established. Treatment for at-risk children and families to prevent problem behavior, including sex offending, should be established. So this is the overall view of how to prevent or stop sexual violence. Coming to the take-home message, always remember, protecting our people protects our mission. This is this year's 2019-2021 theme of sexual violence. Police personnel should not be present at the time of history taking, examination and evidence collection. ER physician and a female healthcare professional should be available while examining a female and a child victim. Consent from all victims and if minor parent and guardian should be taken. As per the law, the hospital or the examining doctor is required to inform the police about the sexual offense. If the survivor does not wish to participate in the police investigation, it will not result in denial of treatment for sexual offense. Informed refusal will be documented in such cases. So you are not supposed to deny the person. You are not supposed to deny the person treatment. Only thing is, you have to document it that so-and-so person refused to give the information to the police and refused for FIR. Collection of sample and preservation is mandatory. Together, we can work to further reduce with the goal to eliminate sexual assault from the society. I am not a victim, I am a survivor. So this is a slogan, and April is a Sexual Assault Awareness Month, and the theme of 2019 to 2021 is Protecting Our People Protects Our Mission. Thank you, Chandru sir, for being my mentor. Thank you, dear family, for being so sweet and supportive. Thank you, dear friends, organizers, and audience for patient hearing. Thank you, God, for everything that is given to me in this world. Thank you, one and all. Thank you. Sir, మనం ఒకసారి చూసుకోవచ్చా?